people learn somewhere along the way that being thin is really important and it's ideal. And they may even experience direct pressure to be thin. It can be bullying, it can be messages from the media. They might even be involved in activities where there is a focus on being thin, such as modelling or dance or other types of sports like that.
Hello, I'm Dr Jodi Richardson, and you're listening to, well, Hello Anxiety, a podcast where we end the struggle with anxiety and build our toolkit of practical skills to thrive. Hello everyone, thank you for joining us for another episode. Today's guest, Dr Emma Black, is an amazing woman. She is a clinical psychologist as well as a supervising psychologist. And what that means is that she supports interns and registrars to develop their own skills because it's a long road. There's a lot to learn, and having someone like Emma supporting them is very, very special. Dr. Emma Black has worked in trauma services, public mental health, hospitals, education, and private practice. And she's here today to help us to develop a better understanding of eating disorders. And this is the topic of her doctoral thesis. And what we know is that around 2/3 of people with an eating disorder also have an anxiety disorder. So Emma, welcome so much. Thank you. Welcome. And I'm getting excited. Welcome and thank you so much for being here with us today and sharing your expertise.
Thanks for having me, Jodi.
This is take 2, everyone. So I had a bit of a tech issue that I could not resolve, which was the first time in nearly a year of podcasting. I couldn't resolve it. And Emma was so gracious to say, let's just revisit this a little bit down the track. So thanks again, Emma. Can you please tell us a little bit about what precipitates this kind of behaviour and these kinds of choices that people make when an eating disorder begins?
Yeah, it's all about your relationship with your body. So people learn somewhere along the way that being thin is really important and it's ideal. And they may even experience direct pressure to be thin. So it can be comments from other people, it can be bullying, it can be messages from the media. They might even be involved in activities where there is a focus on being thin, such as modelling or dance, gymnastics, or other types of sports like that. That kind of relationship with your body starts it all off. And then once people start dieting, because they're unhappy with their body, it's not thin enough, it's not good enough, doesn't look the way that you think it should look, then that's when it all kind of starts to slide downhill. And one of the things that does happen is people have a lot of negative feelings, which can include anxiety. And anxiety, not only are they quite comorbid or happen a lot with eating disorders, but they're actually a feature of eating disorders themselves. So we'll talk about that. We'll talk about that soon. But the thing is, there are these really difficult feelings like being unhappy with your body, being anxious, having other painful emotions that you just don't quite know what to do with. And then that gets expressed as behaviours like not eating or over-exercising, binge eating or purging.
It's interesting, isn't it, when I think as a parent, you know, from that lens as to what we can do when you talk about the messaging that people have been on the receiving end of through the various channels, whether that's at home or at sport or at school, or what's protective for people when it comes to eating disorders? What are the types of conversations, language, ideas around body image that we can do that can be protective against eating disorders?
Yeah, so displaying acceptance for all body sizes and shapes is fantastic. And there's been some work towards that in the media, which is also great. But even within like your family, and even like, what do you do when your kid is like pointing out, say, oh, you're in the shops, and you're like, Mum, that person's fat, like, because kids do this sort of stuff. And it's like, well, how do you kind of then manage that, right? Because that implies straight up, like being fat is a bad thing. And so pointing, like how you address those conversations, pointing out things like, we don't say that, that's rude, that doesn't actually imply like acceptance for all different body shapes and sizes. So having some pre-prepared comments like, bodies come in all shapes and sizes and we don't need to comment on them, that's actually helpful. So I think accepting body diversity and moving towards that body positivity, regardless of what your body looks like, because that doesn't determine your worth as a person, is really important. So how do you share that with your kids?
I've always been of the mindset that I'm in awe of what the body can do, and it's about function, and it's about health, and and just absolutely no references at all to weight. In the 12 and, well, I was going to say the 12 and 14 years I've been a parent. I've been a parent for 14 years, but that's the age of our kids, and not having scales. And I remember seeing a meme many years ago, and it was a little cartoon, and it was a little girl talking to her friend in the bathroom, pointing at the scales and saying, "Don't ever stand on that, it'll make you cry." Oh, I know. And yes, we never had scales in our home growing up, and we don't have scales. I don't weigh myself. And in fact, I am probably the heaviest I've ever been, but I'm probably the healthiest I've ever been, because of my exercise and muscle and things like that. So I think having a good understanding, like you say, about different body shapes, and that like you say, bodies come in all sizes and all shapes. And at the end of the day, I think that that's a really powerful message for us to be sharing in our families. One of the things you said before was with respect to anxiety being something that's comorbid with eating disorders, but also a feature. Could you please tell us more about that?
Yeah, so once people develop disordered eating or have an eating disorder, basically they are riddled by anxiety, because that's actually what drives those behaviours. So people can usually successfully avoid that anxiety if they're following the rules of their eating disorder. But when you don't, you can be highly anxious, even having panic attacks. And it can be to this phobic level where you kind of can't participate in your life very much. So what that actually looks like is people have strong fears of certain foods. They can have good foods or bad foods, safe foods or unsafe foods. And it can be debilitating, because if they are put in a situation where they might, say, even have a bite of an unsafe or a feared food or a bad food, that can trigger high distress, high anxiety, panic. And for some people, like even just having one bite of a feared food can then trigger a binge eat as well, which has a lot of distress associated with that. So the anxiety is about food, and people develop food rules to help them manage the anxiety. People get really anxious about their weight, that number on their scales. They get really anxious about what their body looks like. So even with anorexia, one of the symptoms of that is an intense fear of gaining weight. So that kind of steps are taken at all costs to avoid weight gain. People become really anxious about breaking rules. And while I talked about food rules, like good foods and bad foods, there are rules there about other things as well, like exercise, how much you exercise, and even like what you kind of can do or how you display your body. So people become really unhappy about their body and really anxious about what it looks like. So if you're not feeling good in your body, to think about going out and socializing can bring on high anxiety and distress. So people often avoid that when they're having a bad body day. People also have anxiety about, going blank for a moment.
It's okay.
It's about food. Yeah. It's about your body. It's about fear of gaining weight. Oh, and that's the other thing. People are often really anxious to eat in front of other people, and that's something that's often avoided, regardless of what the eating disorder is. So food can kind of become this hidden, isolating thing. And another thing that happens is that people become really afraid of being judged by other people, judged for their body, judged for what they eat. And so that drives a lot of avoidance as well. So you don't socialise as much. Or you hide your body. So you don't go swimming, you don't go to the beach, you cover up. So There's another thing too that people get really anxious about. Sorry, it slipped my mind.
It's okay. It'll come back. And if it doesn't, that's okay. You've shared so much in the way of insights for us. And I picture a, in my mind, I'm picturing a young lady who's in really baggy clothes. And my interpretation of that was she's hiding her thinness so other people don't ask her about it. But in fact, I realize that that interpretation might be incorrect. What's that about? Because it seems to be a common theme that the clothing is big and baggy. And what's the purpose of that kind of dressing?
Well, I guess the probably the place I'd start is there's only a small group of people with eating disorders who have like really thin bodies, and most people actually have a normal body weight or even are in a larger body. So yeah, like wearing probably clothes that aren't form fitting, that does happen if you're at like a lower body weight, but it also happens when you're in the normal or typical body weight range or a higher body weight range. So wearing something that's really form fitting happens for people in all different body sizes just because they have an eating disorder.
Yes. And what are the different types of eating disorder?
So yeah, anorexia is probably the one that's like most well represented in the media. But we also have bulimia, which is where your self-worth gets really influenced by what your body looks like. And usually there's binge eating, which is like losing control over food and eating a large amount really quickly, feeling uncomfortably full or sick. And then there's usually some steps taken to like compensate for the binge eating, and that might be like not eating much the next day, that might be vomiting or purging, or it might even be like going to the gym a lot just to like offset the binge eating. And so people who have bulimia are typically in a normal body weight range, or they might have a larger body. But there's also binge eating disorder, which is having regular losses of control over your eating, where you binge eat regularly, at least once a week for a number of months. And so probably the most common ones or the most well-known ones are anorexia, which is where you have a low body weight, fear of gaining weight, and behaviours like restricting, not eating much, dieting, binging or purging. Then there is the bulimia and binge eating disorder, but also we have other diagnoses as well. So people might have a fairly typical eating pattern, but be doing behaviours that are unhelpful, like vomiting after a typical meal or using a lot of laxatives. And so really kind of as long as there's any kind of disturbance in your eating or something that causes you a lot of distress or causes difficulty in your life, like you find it hard to socialise because you're afraid of getting caught to eat out with your friends, then you can actually be looked at getting diagnosed with an eating disorder. But a diagnosis isn't the be-all and end-all. Sometimes people have distress over stuff that wouldn't meet criteria for a diagnosis.
Yes, and that's the thing, isn't it? That I know when we talk about anxiety, an anxiety disorder being something that's frequent, extreme, getting in the way of daily functioning. But there can be, it's a continuum, isn't it, when it comes to these things? It's people can be, everyone experiences anxiety, but yeah, just because you don't meet the clinical guidelines of diagnosis, like you say, I think that's really important that you've shared that with us. What advice would you give to someone who cares for someone with an eating disorder?
Yeah, so it is really hard to kind of watch this happen to someone that you care about. So it's a real challenge. So well done for persisting, because it can be hard to just get someone through the door to help, to even want to get help, to be open to having that conversation with you. Sometimes people just deny it flat out because they're not interested in or not up to having a difficult conversation. So where can you start? Well, there's a lot of great resources around. I think the Butterfly Foundation is a fantastic one. Calling their helpline is a great place to kind of get this advice directly. If someone has talked to you and is open to seeking help, then it would really be starting with your family GP. And not all GPs are across like eating disorders or have much expertise or knowledge about them. So if you kind of don't get the response or help that you need first time, like don't give up, keep trying. There are also support groups for family members caring for someone who has an eating disorder. And they're run from a number of different organisations, but again, the Butterfly Foundation could give a lot of advice about that.
I remember ringing the Butterfly Foundation many, many years ago when our daughter was just starting to notice body shapes and sizes, and there was a inwardly focused kind of perspective there for just a short period of time. And oh goodness, and I thought, I'm just going to straight up get some advice because I'd really like to handle this in the best way that I can. And there was no, I wasn't worried, but it was just the first kind of conversations around these things. I think this first awareness of the differences and this, self-reflection. And one of the things that I said to the woman who was amazing on the phone was, I'd said to our daughter, I said, look, I'm not perfect. Everyone's got a different body, everyone looks different, and it's about what we can do. And and I genuinely look at my body as it changes. I'm 50, not next year, the year after, and I keep very fit. But I just think, you know what, I am so lucky to have strong legs that I can run around and do all sorts of things with, and I can, I'm thankful and grateful for the body, even though it is changing, and that's my genuine perspective. And she said to me that by saying to our daughter that I'm not perfect implied that somebody else might be. And I thought, oh my gosh, it's so easy to say the wrong thing in a well-meaning way without good advice and without getting this kind of help and this kind of support. And I realized, straight away, yes, that there are different ways that we can talk about it. And the way that we parent our own kids is a product of how we were parented as well, and what was said to us and what we learned. And so I love that there are these resources available now for us to turn to and for us to have conversations like this. So what would you have said in my shoes to a young person who's starting to notice or maybe be even a little bit critical of themselves? What would you say? What would you recommend that we say as parents?
Well, my first step would actually be curiosity. Like, where does that come from? Where have you heard that? And just sort of questioning where those statements have actually, come from. And sometimes people don't know. Sometimes they're too young to know, but actually not taking that as fact and starting to question is really important. What you get back is then kind of how you can respond. But if someone is saying to you, well, I don't know, it's just the way I feel, then having a gentle discussion about, well, people can feel all different types of things about their bodies, and maybe right now you're not feeling so good about your body, but when have you felt good in your body? And kind of again continuing to question and explore like all kind of sides of the coin. Because when we're dismissive, like when you kind of say to a young woman or a child developing into a woman, no, don't think that way, or you'll be fine, when you kind of just go, you look perfect as you are, what are you talking about? When you're dismissive, it actually is really unhelpful. So gently exploring if possible. And it's a big ask for a parent because you have to self-regulate, right, your own reactions to, oh my God, my daughter is not happy with her body and where did this come from? To kind of just jump into their shoes. But even for a few minutes, you can get some important information that might kind of then guide what you do.
Yes, and it's that catastrophic thinking, isn't it? And that's where I was. Because I live with an anxiety disorder, and I manage it well, but I'm human like everyone else. And in that moment, that's exactly where my head went. Where could this lead to? And I felt a pressing need to get this right, which, right is different under different circumstances with different families. But I just felt this need to be more equipped to kind of handle what was happening in these conversations. And I just love your question about curiosity. I remember my mum saying to me, she's amazing, my mum, a brilliant support. And she's given me a couple of really key pieces of advice as a parent over the years. And one is don't make idle threats. Don't make which this was back when they were little babies. I don't make threats at all, but don't say you're going to do something and then not follow through. I think was a general meaning there. And the other one was ask a question, like you said, about where something's coming from. And she shared the funny story of the little kid that asked their parent what sex was. And the mum didn't ask, oh, where's that question coming from? Tell me why you're asking me this, or, where have you heard that word? Or, and just launched into this big, explanation, and then said why. And he said, oh, because Dad said he'll be back in a couple of secs. And I've always remembered that. And so, yeah, it was such good advice. And it's a funny little story, but that leading with curiosity and that idea about regulating ourselves and whether or not we're supporting a partner, supporting a child, supporting a friend, that ability to take that little space, isn't it, in between the learning of the news or the insight into what's happening with someone we care about and then responding. Can you talk to us a little bit about that space and how, a person who's highly triggered, of course, because they're caring for somebody with an eating disorder, what they can do to look after themselves so that they're in a better place to respond rather than kind of react when having these conversations?
Yeah. So probably having good support for yourself in general will be helpful. And also remembering that carers need care too. So I guess I'm kind of talking about protective stuff, like making sure you do take time for you, creating that space for yourself, and that self-care will actually give you more resources to be able to respond rather than just react or catastrophize. But when you kind of do get caught on the fly and someone asks you a confronting question and you're feeling all the feelings, that kind of wanting to be curious, it can just fly out the door and the knee jerk can happen. And so the best thing you can do in those moments when you're feeling those big feelings yourself is actually to give yourself a time out in the kindest possible way, because unless there's an acute crisis, nothing has to be dealt with then and there. It's okay to go, look, that's a really big question. Can you just give me a few minutes to come back and we'll have a discussion about it? Or, we're running out the door for school. I really want to do this conversation justice. It's important to me. I know it's important to you. So can we actually make a time this evening to have a good conversation about it? So you can put things in place to give yourself more space so you have more resources to be able to be curious rather than just caught in your own feelings.
Oh, that's such a beautiful and powerful answer, because, I think it can often feel like, I have to deal with this here in the moment, and that it can be inconvenient, it can be overwhelming, it can be just completely the wrong time. So going back to supporting somebody with an eating disorder, you've talked about so beautifully about those first steps to seeking that help and getting those insights from the GP. And I was going to say too, I know at our GP clinic that there are, as there always are, and you mentioned before, some GPs have specialties in different areas. So you can always ring the clinic and say, I'd like to talk to someone about this. Can you recommend someone? And those forums are no doubt good places to get some advice in your local area. But when it comes to a person struggling with an eating disorder, what kind of treatment, or what helps them to start to progress back towards better health?
Well, I think just also recognising that's a massive step to even wind up in treatment or to wind up getting help or therapy, because there's so many hurdles to be bridged then to even get to that point, because people are often not quite ready to change or not quite wanting to change. So that is massive in itself. If you have an eating disorder, or your young person has an eating disorder and you can actually get them through the door of the GP in the first place, amazing. And then from there, Well, I guess the GP can kind of open up the pathways because it can actually be different depending on what your symptoms and difficulties actually are. So, look, medical monitoring becomes really important because eating disorders take such a toll on the body and do cause a lot of physical damage, particularly over time. So getting good medical help and monitoring is key. From there, if someone is actually kind of moving to say into therapy, we know that having a treatment team is actually best for people. So it's not just like seeing a psychologist or a therapist. Usually you need a multidisciplinary approach for the best outcomes. So that can be like the medical input. It can be seeing a psychologist. It can be seeing a dietitian. It can also be seeing a psychiatrist too. And sometimes people wind up doing that through the public system. Sometimes they wind up doing that through the private system. Sometimes they kind of bounce back and forth between all different systems, whether that's like working on getting the help in the community. Sometimes people do need to have hospital stays at times, depending on how severe or responsive the eating disorder is. So it's kind of, it can be all over the place because recovery isn't linear. So it's just depending on what's happening for someone at the time.
When it comes to the anxiety, the anxious thinking, and all of the physiology that comes with the anxiety in combination with the eating disorder, what sort of suggestions do you have for somebody who's struggling with an eating disorder to help them with that side of their health?
Well, it's about recognising that the anxiety can directly influence the symptoms of your eating disorder. So like a symptom of anxiety is loss of appetite. And also if you have a lot of that restless agitation, you probably feel like you need to go exercise in order to manage that state. So recognising that it will kind of make your eating disorder worse. So it is a really important question, like how do you manage this then? And I think, there's a number of different ways that people do manage anxiety that can be done through getting psychology help. People can also look at medication for anxiety as well, which can actually just take the edge off enough for you to kind of see that for you to not feel as distressed and therefore reduce the severity or impact on your eating disorder. But it's really hard to kind of give general advice about that because it's different for different people, and people get really anxious over some different things. But I think probably some key ways you can kind of work on that is recognise that the anxiety is there, and also consider like how you self-regulate that. So people usually turn to the disordered eating to help regulate that, like not eating, overeating, or exercising. But are there any other options? So people who manage anxiety and don't have an eating disorder can look at doing things like relaxation skills, like breathing exercises, like even spending time with someone that they care about and talking about their feelings, because that accessing of support and that sharing of the anxiety often helps bring it down. So I guess considering things outside of your eating disorder to help you manage that. And I feel like this is also a really good time to put in here that there's some really great books on recovering from eating disorders that are so helpful, because it's really hard to do on your own and without help, because once you get an eating disorder, particularly if anxiety is there, you get stuck in like this vicious loop that's really hard to get out of because you're anxious, so you don't eat certain foods or you over-exercise, but when you do that, it maintains the anxiety. So you get stuck. But some starting points to help you kind of get educated and break out of these loops. Two fantastic books I recommend to all my clients. One is Overcoming Binge Eating by Christopher Fairburn. And this was actually written by the guy who invented a really helpful treatment for eating disorders. So he's like really well resourced in this area and an expert. And then another one is 8 Keys to Recovering from an Eating Disorder, which was written by Carolyn, Costin and Gwen Schubert. And both of those women are actually therapists who treat eating disorders, but they both have a lived experience of it themselves. So again, they really know what they're talking about.
Oh, they're amazing resources, and I'll include those in the notes for the episode, which you can find on my website under the podcast tab and scroll to the episode, or you can go straight to your podcasting platform, and those notes will be accompanying each episode. So thank you so much for that. There is a lot of help available, and what are some of the barriers that people face to reaching out for help?
Yeah. So people usually suffer in silence with an eating disorder. They wind up quite isolated. They don't talk to other people. It's one of those hidden disorders. So to even think about telling someone, including a health professional, that you have one or are struggling with your eating is massive in the first place. So that will cause you anxiety, right? Simply talking about that you have this or are struggling with something to do with your body or eating. And so that's a massive step to overcome. Other barriers to help seeking are that people aren't always wanting to change or ready to change, even if they have periods of high distress. So sometimes you can hit this crisis point where you're like, yes, I want to seek help. You make an appointment with your doctor or with a therapist or a dietitian or someone else. And then by the time you get there, you're like, no, I don't really want to be here. So it can kind of be this back and forth. I would really encourage anyone who makes an appointment and then has doubts about whether they should even go to just go anyway. Because sometimes you might be surprised by the feedback.
It's one of those things I think to be mindful of is that sometimes you can feel a sense of hope just by making a decision, but then you go and seek the help and realize that it's painful to talk about. It's uncomfortable. There can be shame involved, I imagine, when it comes to eating disorders. And my heart goes out to anyone who's struggling with this and to families who are living with this in their homes. And just, I think, to have an understanding that there is help available, that any type of change is hard, no matter what it is that we're trying to do in our lives, but just to be guided by the fact that the help can make such a powerful difference to the way that you live day to day, but it's just going to take a little bit of time. It's going to be uncomfortable and it's not always going to be easy, but to keep that kind of big picture in mind, that it's worthwhile, and anything that's meaningful in life brings challenges, doesn't it? Anything, whether it's doing something out of your comfort zone, asking somebody on a date or going for a new job or asking for help, those things that are important can be challenging. So I think it's nice to kind of preempt that. So it's not a surprise, but people go forward with a willingness to go, look, I know that it's worthwhile persevering through this support, this seeking of support, because the outcomes will make life so different. But there's a period in between where it's going to be a bit tricky.
Yeah, and I think the thing that's really beautiful to bear in mind and gives people hope is that the research is really clear that when you undertake an evidence-based treatment and you have a good team, recovery can happen, and it does happen more than people think. So there is every reason to be hopeful. And the other part too that gets people really anxious is what does your life look like? What does my life look like without an eating disorder? So that becomes a really scary thing. And sometimes, for some people, it's not about getting rid of the eating disorder altogether. It's about building a better life, one that's less distressing and one that we have more joy and more positive feelings in, even if you still have some disordered eating behaviours. And I think that is all worth striving for. So it's kind of just pushing through or persisting through that anxiety and distress to have a conversation and to seek help can actually open up those opportunities for a much better life.
Oh, it can. And it's so great that you raised this. I was recently talking with Sarah Rusbatch. We met for lunch when I was in Perth. She did an episode with me about grey area drinking. And one of the things that she was talking about with me over lunch is that when alcohol is something that people choose to take out of their life or to remove from their lifestyle, that something else can often take its place, and she finds that a lot of the time that's sugar. And so I think this awareness that with the help and the support of a team of people who are experienced, that not only will it be about helping you with your distress and with the choices and the behaviours that are around the eating disorder, but other ways that you can enrich your life and move back into the things that you've maybe left behind. Because if you've not been socializing, or if you've been uh, not been working, or that those are steps that you'll be supported to take, so that your life can become rich again. And like you say, you can experience more joy, more connection, more fun, and just be better equipped to make all of the changes that are required, but over a period of time and slowly.
Yeah. And so, getting educated, getting support and help is really key, like we've talked about. But I probably also would love to throw in here as well, like when they've done research with people who have lived experiences of both disordered eating and recovery, like one of the things that people often talk about is that yoga's been really helpful in recovering. And so it is about using your judgment, because if you're at a really low body weight, throwing in a type of exercise is not helpful. But the reason why yoga can be so beneficial, it is about connecting with your body and doing that in a non-judgmental way, not hating on your body, but using it and experiencing it. And that can be quite new to people who are used to potentially like being quite critical of their bodies, beating up on it, or kind of driving it to exhaustion, and not listening to your body. And so yoga kind of is about listening to your body and having a different relationship with it. So that's probably another thing that people can bear in mind that can be helpful to try.
Oh, that's beautiful. And for some, that could mean even just sometimes here at home, when I need to settle my nervous system, I'll put on a YouTube video of a sun salutation, and I'm not a yogi, but I'll just follow the movements, and just slowly and without, overtaxing myself physically, just to kind of become more present, move, shift out of a seat where I've been podcasting or writing or reading. And so those kinds of options are open to people in those ways, in little doses at home, aren't they? Right through to beautiful experiences in classes. And the classes are so special because of that teaching and that learning that accompanies the actual movement. And so, yoga is so powerful. I'm really, really thrilled that you've raised that. And it's that non-attachment, isn't it? That non-judgmental point of view. It's very, very special. I'm feeling so calm. Our dog's just come over. He's just sitting next to me here, and I just realised how much I'm relaxing just patting him. So that's another beautiful thing, isn't it? When anxiety is high and distress is high, is that our animals can make such a difference for us, can't they?
For sure, yeah. And that's also about, your relationships, your quality of life, right? And getting that joy from connection.
That's right. So, what else would you like for listeners to know around eating disorders? From, you've got so much experience in terms of your doctoral thesis and your research. You've got so much experience, obviously, as a clinician and a supervisor. So, are there any sort of other parting suggestions, ideas, insights that you'd really love to share with us today?
I think it's just the importance of trying to take care of your body in a new way, because people often struggle with that. And so when I see people in my clinic to work on eating disorders, often they're not drinking much water. Food is quite a difficult thing, of course. But sometimes it's just those really small steps, like staying hydrated, can actually really offset some of the harmful things that happen to your body. And so, simple steps to try and take care of your body if you can cope with that, I suppose. Like trying to drink enough water, trying to get rest, get enough rest, and trying to listen to your body, which is a big thing I'm saying. And I'm probably saying it to someone who's further down the track, I suppose, than early stages of help seeking. But these are probably the things that reduce some of the medical risks that are posed to your physical health by an eating disorder. So I guess the key point is getting involved with a good medical practitioner is actually really important.
Yes. Yeah, a really wonderful GP is, they're priceless. And one of the things that I'll often suggest is that if you are going to see your GP around your mental health or around the mental health of a loved one, that making a double appointment is often a good idea, isn't it? Because sometimes those appointments can feel so rushed, and if people don't get to the GP often, then there can be a bit of catching up. One of the things I will also recommend is making a few notes and jotting down a few key, really important things that you'd like to say, so that, because the stress of sharing with the GP and opening that door can be enough to kind of make it really hard to think and recall and articulate, can't it?
Yeah, for sure.
Yes, yes. Emma, your expertise runs so deep, and your compassion is so evident in this forum. We can see each other; other people can't obviously see Dr. Emma, but I know how passionate you are about your work, and for you to be able to spend this time with me on a take two, and to be able to really support our listeners to understand more about eating disorders in general and really answer a lot of our questions is something that I'm really grateful for. But where can people find you and connect with you?
Oh, yep. So my website is townsvillepsychologist.com.au. It's a bit tricky because I'm not taking new clients. So it's probably, if people want to get information, I've got some blogs there about disordered eating, like why they start, why they continue, what they can look like. So yeah, I'm townsvillepsychologist.com.au.
Oh, fantastic. And whilst you might not be taking new patients at the time of recording, is it possible that you will open up to new patients at some stage?
Yeah, so that's likely to happen towards the end of this year in 2022.
Are there any associations that people could reach out to be directed to a psychologist who might have more expertise in this particular area?
Yeah, so the Butterfly Foundation has a referral network, and they even include like dietitians, psychologists and GPs, which is fantastic. And then there's also other organisations like Inside Out, the Inside Out Institute, Queensland Eating Disorder Service. They also have clinicians there. There's a number of different private practices around Australia that have a focus on eating disorders. So Google is a great resource in itself. And so looking for someone who not only has an interest in eating disorders, but has experience in it, looking for the treatment model will be important, because we know that eating disorders generally respond best when someone uses an evidence-based treatment developed specifically for eating disorders. So don't be afraid to ask the questions. Like if you get sent to someone new and you're like, can you actually help me? What do you offer? What is your experience? What's your treatment model? I think these are all really important questions.
Oh, they're such important questions. And we ask dozens of questions when we're buying a car, or we're even, thinking about a new phone, or we're going to a restaurant. We ask questions, and it's a little bit of a hurdle. It feels like it can be a hurdle, but it shows your investment in your treatment, and these things can cost money as well, and they take time. And so really maximising and optimising the time that you spend with the person that is there to support you is really important. And if you don't feel comfortable asking in person, you could certainly send an email, or you could get somebody who cares about you to ask on your behalf. And so I love that you've brought that to our attention. This is just such a joy of the podcast, because the insights that you have and that you've been able to share will make such a powerful difference for people no matter where they are on their journey with these kinds of challenges. And I'm so grateful for your time, Emma. Dr. Emma Black, thank you for being with us here today. It's just been a really fantastic conversation, very, very helpful.
Thanks, Jodi. Thanks for having me on.
Absolute pleasure, absolute pleasure. Thank you, everyone, for joining us. And we will be back again next week. New episodes drop every single Wednesday without fail. And we're approaching a full year of weekly podcasting, which is pretty cool. So thanks for your support. Thanks for all your lovely messages. And I'll see you next week. Bye. Thank you so much for joining me for this week's episode. If you enjoyed it, please subscribe and leave a review. To keep the conversation going, I'd love you to join me over on Instagram. You'll find me at Dr Jodi Richardson. Also, if you'd like a copy of my free 5-day mini email course, Calm Your Anxious Brain, then jump over to my website, drjodirichardson.com, and you can sign up down the bottom. I've really enjoyed having your company. Thanks so much. See you next time.